So now we're going to talk about a letter to the editor that we published on the initial observations and management of coronavirus in multiple myeloma. Very early on in March and April, when the pandemic started, we started looking at the cases of coronavirus that came to our hospital. And we looked at the first 12 cases, and we found that most of those cases were actually multiple myeloma. So 5 of the first 12 initial patients were myeloma. And we wondered, why is that? Why half of the patients that are coming with this with this disease have multiple myeloma? And we described these patients, and most of the patients had actually the same symptoms as patients that don't have myeloma. So very typical, the fever, the loss of the sense of smell. We had some patients with diarrhea, and then most patients had respiratory symptoms, including hypoxia and dyspnea. We also looked at the treatment. The treatment was no different in the patients that had multiple myeloma. What we could see is after treatment with, for example, we used at that time tocilizumab, there was decrease in C-reactive protein with treatment, in ferritin. There was also, when we used interleukin-6 directed agent, there was decrease in interleukin-6 as the patients improved. And we also looked at, for example, the patients that had myeloma, what happens to them. And I can say that, I know now these 5 patients that had COVID and myeloma, they all recovered. They eventually left the hospital. There was one of them that was a little bit sicker, but but he recovered from this eventually. So none of these patients that I know of died from COVID. This was a very early observation of COVID in myeloma, and it has turned out, for example, in New York, where they had a lot more cases that we have had in Houston. There has been a publication describing this in about 100 patients with multiple myeloma with COVID, and looking at large data sets of patients, it was concluded that the incidence of COVID in myeloma patients is about the same as it is in other cancers. It doesn't seem to affect patients with myeloma more, and they also don't seem to do worse than other patients. I think that this may also be due to the new therapies that have come about since the pandemic started, and also the increase in expertise in management of this disease. Overall, patients with multiple myeloma are prone to getting infections, especially respiratory infections, and COVID-19 is one of those infections. So definitely patients who have multiple myeloma, who are in active treatment, especially even those who are not in remission, should definitely take precautions and continue precautions of hand washing and mask wearing and isolation, not being in large groups of people doing activities. In terms of the vaccine, the COVID-19 vaccine that has been approved, the Pfizer vaccine and the Moderna vaccine that may be approved as well, we're probably going to recommend that, especially myeloma patients in remission, that they should discuss with their doctors if they should receive the vaccine or not. So there has to be a discussion about what should happen. But my impression is that especially vulnerable populations such as multiple myeloma patients should probably receive the vaccine.